May is Mental Health Awareness Month. Millions of children have been diagnosed with attention deficit hyperactivity disorder. You've heard of this, ADHD. But given a child's surroundings, there could be so much more to the story. Katie Fieser joins us this morning from Eskenazi Hospital to talk about it, especially one study that says folks may be actually suffering from a different disorder and things can kind of get confused. Thanks for being with us.
Yeah.
So what does the study say?
So there was a study done in 2010 by Nicole Brown at Johns Hopkins University that said that out of 65,000 children who had been looked at, I guess a third of them were looked at to be considered to have prescriptions for stimulant medication, which is generally what is prescribed for ADHD. Those were also children who had ACEs of 4 or higher, which means they'd experienced adverse childhood experiences that were traumatic in some way, and so they had 4 or more. So we're looking at the link between, on the outside, what shows as impulsivity, inattention, hyperactivity, and we're looking at how that actually sometimes is related to trauma.
And this has to be a tough question, but for clinicians like you, how can you tell the difference?
It is hard on the outside. We have to dig deeper, so we have to do a lot of good evaluations and using different screenings to really explore throughout their lifetime, have they encountered any sort of events that in a moment where they experienced it, that they felt like their integrity or physical safety was really threatened. There's a number of types of experiences that can happen, so we really have to do good comprehensive mental health evaluations.
And we know that some young people, of course, do suffer from ADHD, but for those who maybe are overdiagnosed or overmedicated, what can the risks be?
Well, the risks can be that they're not going to actually have their trauma symptoms resolved. We need to get in a completely different type of therapy and a different type of approach, because trauma is something we know that our body remembers. It will stay within us unless we do some good work on rebuilding our sense of safety and working through emotional dysregulation we've developed and overcoming some of our ongoing panic and anxiety.
So what would your advice be to a parent in this situation who their child maybe seems like textbook ADHD, but maybe that's not the case?
I would say probably get your child linked to a mental health center and ask for a good full evaluation to screen for trauma. That way we can decide what kind of treatment is needed.
All right, Katie, thank you so much for being with us today. We really appreciate it. Such helpful information. Of course, you're seeing again on your screen here some of the issues that can cause these disorders. And keep in mind when you bring your child to the doctor, of course, to ask questions. That really is the key. Katie, thank you so much for being here.